You're watching CTOM TV. Knowledge is power.
So we're picking up. We didn't take a detour, but it took us a while to get here. We talked earlier about those the four pillars: the genetic and molecular testing, the personalized research, the targeted therapies. We've just run through a few of those options, and now pillar 4, which is how do we keep an eye on this and make sure that your treatment is working as well as it should, that you don't stay on a treatment when your cancer is gone. Is sometimes in standard care, if the protocol is 12 doses of something, but you may have responded adequately within 6, you don't need all that extra treatment, and I'm sure would prefer not to have it. So the more accurately you monitor how your treatment is working, the more successful your treatment can be.
Great point.
So liquid biopsies, Alex, what do you want people to hear about that?
So once we know your mutations that are causing your cancer, then what we can do is we can use them to monitor you. So the standard monitoring to see if you're responding to a treatment is CT scan. Are your tumors growing or are they shrinking? Oh, you don't need to wait around for that, and you don't want to wait around for that. If you're fairly late stage, you don't want to wait 4 months and say, oh, your tumors didn't respond to the drug. Sorry, nothing else for you. Now you got tumors all over your body. You want to know in real time. And so another tool that we use that is really beneficial to tell you whether your treatment is working or not, whether your tumors are coming back or not, is once we know what genetic markers you have, then we can use those and we can track those within your blood. So we can take a blood sample. Let's say you have a KRAS mutation, and we know it's only in your tumor cells. So we can actually test the level of your blood for that mutation. We can say, well, it's at 8% before you start this new drug. And then 2 weeks later, after you've been on the drug, we can test you again. And if that percentage has gone down from 8%, let's say it's 2% now, then we know the treatment's working. Or if it hasn't gone down, then we know the treatment's not working. We need to do something else. There's a multitude of different ways we can look at that. So obviously, one of the most important things is knowing whether that treatment is working. And this is one of the ways we can determine whether treatment is working is through a exosome-based liquid biopsy.
Thank you for watching CTOM TV. Subscribe below and stay informed.